President Cyril Ramaphosa calls it vaccine apartheid. The head of the United Nations, Antonio Guterres, says Southern Africa is being unfairly isolated by travel bans after our scientists warned the world about the new variant. And as you've just heard, Professor Salim Abdul Karim said if pandemics are a test of the world's humanity, we have failed dismally. Unequal distribution of vaccines, unfair travel bans, wealthy countries ramping up booster programs while poor nations are still waiting for their first shots, all ignore the reality that COVID-19 will mutate and thrive until it is under control everywhere. I'm joined now by Dr. Margaret Harris, spokesperson for the World Health Organization. Dr. Harris, thank you so much for your time. The head of the WHO, Tedros Ghebreyesus, says Omicron is a reminder that the longer vaccine injustice prevails, the more the virus is going to circulate and mutate. Is this the wake-up call the world needs, or, as Prof. Salim Abdul Karim suggests, have we just failed again?
It's certainly a wake-up call, and the trick is to have the world listen. So right from the start of this pandemic, we worked out that what was needed, good science, good solutions, but the thing that would make all those things work together was solidarity, and that's what we haven't seen enough of. And let's hope that finally those who are not acting in solidarity with their fellow humans will get it, that it's not about being a good person, it's about being a smart person.
Yeah, it's interesting that today we get the news that France has decided to reverse its ban. They put in a one-week ban on Saturday. Their flights to and from South Africa and France are going to resume with very clear testing conditions. Is that something that you think might lead the way to other countries doing the same?
Well, it's certainly good to hear that they used that time to put a good response together. As you know, the World Health Organization, we do not like blanket bans, mostly because they don't work, because whatever you're trying to keep out is usually already there. But if you're going to do it, use that time very well to get your systems up and running, to have a good response in place so that what you're doing will really help manage the spread of the pathogen.
You know, at the same time, you know, obviously a lot of criticism of these travel bans. It's not been fair on Southern Africa, but we have also seen a great deal of donations of vaccines by many Western nations involved in COVAX. And, you know, COVAX, of course, and also efforts at the WHO to try and create some sort of equity around access to vaccines. Those calls were being made even before the vaccines were actually out and done and produced. WHO is setting up a number of facilities to speed up access, to make sure that this wouldn't happen. Why has it not been effective?
So you're absolutely right. Again, right at the beginning of the pandemic, we realized that the solution would lie in not only finding the vaccines, finding the treatments, but being able to distribute them fairly. So we set up the ACT Accelerator, which is an overarching system that governs COVAX. We set that up, I think, in 3 months into the pandemic, long before we had any of the tools. But indeed, unfortunately, this idea of self-interest has dominated. We've seen the resource-rich countries buy up and hoard the vaccines, have way more vaccines than needed. Now, we're very happy to see all countries vaccinating their populations, but also not so hoarding the vaccines that it wasn't possible for other countries to vaccinate their population.
Yeah, and I mean, we're seeing now in the United Kingdom, they're talking about urgently getting boosters out to as many adults as possible, where there are countries in Africa that have such small access to vaccines. Very few people have been vaccinated. How do we fix that? It's
a real challenge, because we have been saying, as you quoted my Director General, and he made it very clear, again, way back in August, September, to please hold off on giving that extra dose. First of all, because the science didn't really say that it was absolutely necessarily, but second of all, we knew that the critical vaccination that needs to happen is that first dose, in the arms of so many people, so many high-risk, vulnerable people around the world who hadn't received it. So we ask that it be done in an orderly way so that you don't have large unvaccinated populations in which the virus can circulate at will and develop an effective variant at will.
And you know, it doesn't follow the science, does it? Because if we don't make sure that this virus doesn't mutate, as we have seen with Omicron, we're going to have this problem again and again. So surely, is it fueled by politics that countries are focusing on their domestic interests, ignoring their international obligations, and the reality that if they continue to ignore what is happening internationally, it's actually going to come back to bite them domestically?
Exactly. But that last part of what you said, which is just so absolutely right, that seems to have been ignored, or perhaps those who are paying attention to the domestic interests because they are the leaders who've been elected, so therefore they feel that their obligation is only to their domestic population. Perhaps they were hoping that that other half wouldn't happen. But as we can see, it is happening. I really hope that Omicron does not turn out to be the variant that escapes the vaccines, the variant that sets us all back. But it is a warning, as you said, the wake-up call. And the difference today should be that we pay attention to it.
I mean, it's been astonishing what's happening with Omicron here in South Africa. Here in Gauteng, the province where we're coming to you from, cases almost doubled in one 24-hour cycle. We've just spoken to the organisers of a big festival that children go to when they finish their formal schooling. And he has told our reporter that every single school, and this is around the country, not just in Gauteng, is now reporting cases. It seems to spread incredibly quickly. What else do we know, though, for sure about Omicron at this point that we can say confidently we do know?
One of the main things that led us to look at it very quickly and led the committee that advised WHO to describe it as a variant of concern, that led that committee to make that recommendation, was the large number of mutations. So we've never seen so many mutations in a variant before, and a lot of them are in the spike protein, and that's the bit of the virus that it uses to get into our bodies. But it also, some of them were mutations that we've seen in other variants that may give an advantage as far as spreading. Now, the other thing that raised the alarm bells as well was the fact that South Africa had you were in a quiet period in your outbreak. You'd actually had a pretty flat epidemic curve, and then suddenly it went straight up. And it went up very quickly at the time that Omicron started arriving and was seen, particularly in Gauteng. So even though there wasn't absolute proof that it was Omicron that was responsible, but it was suspicious enough to make us again say, look, we have to really look at this variant and really, really monitor it and alert the world to look at it properly as well.
All right, thank you very much, Dr. Margaret Harris, spokesperson for the World Health Organization.